Thanks for joining us. We have some breaking news. We have just learned 3 cases of measles in Colorado are connected to a single flight into DIA. Thanks for joining us at 5 o'clock. I'm Kim Christensen.
I'm Jennifer Meckles. An adult has now tested positive for measles as well. 9 News reporter Janelle Finch explains what could have happened with some of these cases. You're also looking at potentially a case where doctors might have missed detecting a virus initially. Lots to catch up on here.
Yeah, doctors say those early symptoms of illnesses look really similar. It can be a cough, a sneeze, a runny nose. It could range from anything from a common cold to the beginning of a measles infection. Doctors say that's what makes the virus difficult to detect early on.
As cases of the measles continue to spread, so does the virus as a talking point.
People are concerned about measles because the spread is particularly vigorous.
Infectious disease doctors say measles is 4.5 times more contagious than COVID.
We want as many people as possible to get vaccinated who have not been vaccinated.
Dr. Jared Eddy is the director of prevention and control at National Jewish Health. He says despite recent cases of the virus, doctors can't assume every new runny nose is measles.
You're not going to test for something that you don't think about. And measles, fortunately, has been so low in prevalence in this country that a lot of people have not seen measles in their career.
Most recently in the state, the Colorado Department of Public Health and Environment identified a measles case with a possible large spread. Before the child was isolated, CDPHE says they visited the Colorado Children's Hospital, Walgreens on East Hampton Avenue, Sam's Clubs on Abilene Street, Natural Grocers on South Tower Road, and Children's Hospital 2 more times. Dr. Eddy says it's possible the virus wasn't tested for or detected in the first hospital visit.
You're not going to test for them unless you actually think about them. So the very first piece of this is just knowing what measles looks like.
CDPHE says symptoms can include fever, cough, runny nose, red eyes, and a characteristic rash can show up.
And you are actually contagious for about 4 days before the rash. So this is what makes it really difficult to actually contain.
But since early symptoms during the contagious stage aren't unique to measles, he says vaccinations are all the more important.
Because measles is so contagious, it will find those people who are not vaccinated.
We asked Children's Hospital for more clarification on when doctors may have diagnosed the child, but we were told they didn't have any more information at this time. CDPHE says symptoms in people who have may visited those exposure areas can pop up between June 12th and June 17th. Janelle Finch, 9 News.